Are you someone with mid-back pain? Let me show you. It's this pain right in between your shoulder blades. It's kind of like in the middle of your back. You can't really touch it. You can't you're like, this pain is driving me crazy and I can't find it and I can't work it out. Well, my name is Huang. I'm an occupational therapist and certified hand therapist with a clinic here in Miami, Florida. And I've been getting a lot of those comments, questions on my website about like, ma'am, I have this pain in the back, right in my shoulder blade or right in between my shoulder blade. Please help me. So I wanted to address that a little bit and to share with you my perspective on what it is. So a lot of times people think it's the shoulder. One, it can be a shoulder. You could have a shoulder problem, right? That's causing you that pain. Two, you could have a neck problem, and all the muscles that go to your neck go from your neck to your shoulder, and a lot of the muscles that help to move your shoulder and control your shoulder complex are also from your shoulder to your neck. And then we have these muscles that run right along the spine, and those also can contribute to how your neck moves, how your shoulder moves. Here's the third one. Could be related to your back. I know, you're like, I'm coming to Huang for shoulder pain, fix my shoulder. Why is she telling me this is a back issue? I didn't make this anatomy up. This is how your body is made, right? So if you think about it, you have your lumbar spine. There's so many muscles, so many bones and muscles. Then you have your thoracic spine that sit on top, and then your cervical spine that sit on top of that. So if you think about it, it's like a stack. It's like the stack of your finger, right? So it's your lower, your thoracic, and your cervical. Now, if you came to me and you're Huang, like, I can't make a fist, like I have pain, I'm gonna look at all of those because those bones and those muscles are stacked upon each other. So when it comes to the mid back and the shoulders, why would I not look at above and below the problem, right? So a lot of times people are like, why didn't I do anything to my shoulder? Why does my shoulder hurt so bad in that back? Let me share with you one simple thing that you can do if you have that mid-back problem there and you can't seem to get rid of it. One of the things that I do with my patients is the easiest thing to do. I do a full-on evaluation of their shoulder. I take a look at how the shoulder is moving. Do you have full motion? A lot of times those people have muscle imbalances where their shoulder blade is not moving as well, but that's neither here nor there. So I can promise you probably like a lower back, a mid back, and a neck issue. So let me just share with you what I tell my patients to do. And I've had this problem too, and I do the same thing. So I mean, if I'm doing it, you can do it. So let me grab a towel. Very simple, hand towel. Roll that sucker up, right? So what you want to do is you want to lay flat, bend your knees, put your feet up, right? What I'm going to show you is called a pelvic tilt, right? The muscles that run all the way up and down your spine start down here, come all the way up and end up here. So there's a bunch of muscles. I'm not going to go into the anatomy of it, but these are called pelvic tilts. And they're so essential to helping your shoulders move really well. So if you have shoulder problems or you have neck problems, you should try this. This is gonna be really good for you. So let me show you first how I do them, and then I'll share with you where most people do it wrong so that you can catch yourself, okay? Pelvic tilts are really simple. If you think about, there's a bone right here. You can put your fingers on it right here. And normally you might have space in between here, right? So what we want is if you have space in between here, this bone might be sticking up. So you want to pull that bone down and make your spine go completely flat against that table, right? Flat. So there's a couple ways to think about it. Think about that bone coming up, and then think about that bone driving itself down, making your spine completely flat. Don't lift up your butt, okay? Because we're not doing bridges. We're just moving that pelvic up and then down, right? So if you think about it too, if you think about your belly button, you're gonna bring your belly button up and you're gonna pull it all the way down, your belly button all the way down towards your spine, tilting that bone. That's called a pelvic tilt, and it does look kind of sexual. I know, my patients are like, can you stop making me do this weird movement? I understand, but it's so key to really solving so many of that mid back pain, shoulder pain. I promise if you do it right, it's gonna help you all in your life, okay? Like in every part. But you wanna do the pelvic tilt, and you can do about 10 of those. They should be really easy, and you want to learn how to find that rhythm between your breathing and doing it, right? But I wanted to share with you the most important part of how to fix it, because my patients, when I do it with them, they always do it wrong. So you might be doing it wrong too. Put this towel underneath your head, not underneath your neck. So what happens is a lot of times when people tilt their pelvis, they bring their chin up and their head moves with their pelvis. What I want you to practice is I want you to put that towel there because you're trying to tuck, you want to tuck your chin in, okay? You kind of give yourself a double chin. Tuck that chin in and then move your pelvis, right? When you tuck your chin in, it's going to move those deep inner muscles along your spine much better, and you're actually going to feel that stretch inside. And believe it or not, it's going to really help to alleviate some of that tension that you feel in your mid back, in the back between your shoulder blades. It can help loosen up. If you loosen up how your lower back is, it's going to loosen up the muscles here, and it's going to loosen up the muscles of your neck, and then help you to move better without pain. There's a lot of exercises you can do. And the problem is if you're doing it in the wrong order, or if you're not doing it as well as you could, they're not going to be as beneficial. And so this is one of the reasons why I always, in my videos, I say, go find a therapist in your area that you like, know, and trust, and see if they can also help. And you just want to find somebody who's willing to look above and below a joint, and it's not always like right there. You want to find someone who's willing to do it, but you as the person who needs help, you have to be open to the idea of like, hey, it's okay, like I can look above and below and make sure that I'm getting, the nuances of the injury, right? Not just the injury, but like why you have pain. Majority of the time you have that mid back pain because you're like the muscles are just not working together as well as they could. So anyway, I hope that video helps you. Pelvic tilts, but you want to tuck your chin in, all right? All my links are below if you need me, and leave me a comment if you have any more questions, and I use that to help me make other videos for you.